Welcome back. Our subject today will be a pericardial disease. So let's start. What can cause a pericardial disease? We have three pathologies like pericarditis, pericardial tamponade, and constrictive pericarditis. I have here a picture drawn by me of the heart. We know well that the heart has three layers like pericardium, myocardium and endocardium. This information is known well by everyone. It's nothing for discovering here. I'm just trying to explain in a simple way. So a pericardium have a pericardial sac that is very close to the pericardium, and normally these do not formate a cavity or anything between them. Normally, inflammation of the pericardium will be pericarditis. Like this layer will be inflamed. In a pericardial tamponade, we have fluids between transudate or exudate, and in a third cause like constrictive pericarditis, we will have a thickening and fibrosing of the pericardial wall. Let's start firstly with pericarditis. Pericarditis by definition means inflammation of the pericardium. So what can cause a pericarditis? Infection. So any infection can cause pericarditis. Most common are Staphylococcus and Streptococcus. Also viruses like Epstein-Barr or Coxsackie type B, and even fungi can generate infectional type of pericarditis. Any inflammation, any connective tissue disorder. Here we can talk about rheumatology and diseases like systemic lupus erythematosus, Wegener, Goodpasture syndrome, rheumatoid arthritis, and many other connective tissue disorders. Cancers. Why cancers? Because they metastasize, and the position of the cancer tissue in the pericardium and make this inflammation. And trauma, chest trauma also may declare this pericarditis. How we can diagnose pericarditis? It is a very specific, very sharp chest pain that changes position or respiratory cycle. So pain is worsening by lying, and it is improving by sitting up and leaning forward. And changing in position will change also liquid level, and tension of liquid on the pericardial wall is changing, and will develop a different pressure applied, a different tension applied on this pericardium. How we can diagnose pericarditis? First tool is EKG for sure. For most heart diseases, EKG is the first tool of assessment. So ST elevation, we see here ST elevation, here, V2, V5, V6, V5 is anterior wall of the myocardium and pericardium, even in a second lead, in a first. So also we have a PR depression. It's like in every lead, but let's see a PR depression here. Here one more. Here. So two things to know for establishing a diagnosis are ST elevation, like in every lead, and PR depression. What is the treatment of pericarditis? One and good treatment is NSAIDs. Why is NSAIDs? Because it is inflammation. We cannot know right in this moment what is the etiology of pericarditis, but NSAIDs have a desired effect on the pericardium. So any of them are good, like ibuprofen, naproxen, or indomethacin. The preferred one is ibuprofen because it increases the coronary blood flow and have just a few side effects. In times that indomethacin have poor side effects and decreases the blood flow to the coronary arteries. NSAID's side effect is well known as GI tract ulcers, so patient should be alert about this. Pericardial tamponade. Pericardial tamponade. It's another cause of pericardial disease. How we diagnose pericardial tamponade? Many symptoms like hypertension, tachycardia, clear lungs on auscultation, distended neck veins, jugular veins distension, and distant heart sound. So we know a Beck's triad like hypertension, jugular venous distension, and distant heart sound. Let's talk about pulsus paradoxus. This represents a decrease in blood pressure more than 10 mm mercury during inspiration. But this pulsus paradoxus may also be seen in cardiac tamponade and asthma and COPD. I can call this effect like stealing blood from the heart, because right heart is going to the lungs, and from lung coming to the left atrium. So when lungs are inflated during inspiration, the blood stay more in the lung vessels, and this decrease return to the heart and even worsen the blood pressure. Diagnosis of cardiac tamponade is made by EKG. I want to remind that EKG is the best tool in any cardiac assessment. We will see an electrical alternance. What means is electrical alternance? Error intervals are normal, but QRS complex height is different. We can see a normal high of QRS and one is small. It's all about ventricle contractions because they are not full. A chest X-ray also may be a tool. We'll see an enlarged heart silhouette, expanded in both directions. Echo. Echography is definitive diagnosis. A collapse of the heart, small chambers, but most accurate tests remain for sure catheterization. Catheterization is not so easy to do. Need a special preparation, but EKG and echo is made very simply and rapidly. What is the treatment of cardiac tamponade? It is pericardiocentesis. It's inserting under the sternum of the needle directly to the pericardium and evacuate the liquid that impedes the normal contraction of the heart. So IV fluids are also given to patient to fulfill the vessels. And the third method is used not so often. It's a shunt, pericardioperitoneal. Pericardium is very elastic. Normally have very small amount of liquid between the pericardial sac and pericardium. Even a 50 milliliters, even 30 milliliters of liquid can generate this tamponade, but from the characteristic elasticity of the pericardial sac, it can accumulate even 1.5 or 2 liters of liquid. Want to mention here that diuretics will worsen the condition because the depletion of fluids is like emptying the vessels, and a peripheral supply will suffer a lot. And third one, it's a constrictive pericarditis. Diagnosis looks like right heart failure. When a patient have right heart failure, a blood go back, I mean to the vena cava, up and down. Up will have a jugular venous distension, down we have affection of the kidneys with edema, ascites from liver stasis, and enlargement of organs like liver and spleen enlargement. Diagnosis of the constrictive pericarditis is Kussmaul sign. Kussmaul sign mean increase in jugular venous distension. Mean by self jugular venous distension on inhalation. Normally on inhalation, as I said, is a phenomenon like stealing blood from the right heart, and jugular and vena cava inferior superior will be depleted because blood is going to the lungs. But here we'll have an distended jugular veins. So please do not confuse Kussmaul sign with Kussmaul respiration. Kussmaul respiration mean a rapid and shallow breathing. Normally breath occur like smoothly, like this. And pericardial knock is an extra sound from filling of a maximum volume against a full and stiff ventricle. Ventricle is small by size because of the stiff wall, and this extra pushing of the blood will produce a sound. Diagnosis is made by a chest X-ray because it can show a calcification. CT and MRI is more accurate, but CT and MRI is done only after X-ray, chest X-ray. Echo. A good test for heart is echo. It show chambers, it show valves, and for sure a heart wall. So what can we expect on an echo? It's hypertrophy and pathological movement. It's discordance between myocardium and pericardium. What is the treatment? Is diuretics, decreasing the volume because heart cannot pump a lot of blood. What is the treatment of constrictive pericarditis? Is pericardiotomy. We see these lines that I draw. It looks like this. Lines of fibroids of fibrinogen, and surgical they are removed, they are cutted, and heart may be liberated by this spider-like net. Thank you very much for your watching and following me. If you like my videos, you can subscribe and be on updated information.